Am I audible, Dr. Rashmi?
Yes, ma'am.
Yeah. Thank you for the introduction, Dr. Rashmi. Good evening, everybody. I am a proud member and director of Society for Prevention of Cancer. So I would like to speak a few words about our Society for Prevention of Cancer. Basically, we established this NGO with an objective of bringing awareness regarding the basic risk factors. We call it as modifiable risk factors, which can increase the risk of various cancers, and also to discuss in detail about the preventive measures which we can make people aware of to reduce those that increased risk of various cancers. And our main aim of our society, SPOC, is to create awareness not only in the scientific committee but also in general public. We are basically focusing on basic measures like altering diet, nutrition, altering lifestyle practices, how to boost your immunity, role of yoga, meditation, and these basic lifestyle changes to reduce the risk of cancers in our society. Another aim of our SPOC society is to create awareness in general public. What are measures we can take? What are the measures we can take to diagnose the cancer at an early stage? We know that if the cancers are diagnosed in a very early stage, it can be completely curable. So it's not only the prevention and risk factors, our focus is also to spread awareness regarding early detection of cancer. So we've been, as part of all these aims and objectives, we've been conducting monthly seminars on various topics, especially the topics which are rarely discussed, not only in the scientific forums, but in general. They are not much spoken about. So our main aim is to discuss about those rarely discussed topics to create awareness, not only in the scientific community, but also in the general public about the factors which I have discussed. So today's topic is also one of those topics which we don't usually discuss much about, integrated therapy in cancer. So I would like our speaker to come on the forum and discuss about the topic which we have chosen today. Over to you, Dr. Rashmi.
Thank you, ma'am, for that amazing introduction. Now I would like to introduce our speaker for today, Dr. Samara Mahindra, who is the founder and director of Carer. With 10 plus years of experience in the field of integrative oncology, Dr. Samara is a cancer exercise specialist and a breast cancer recovery trainer. She has also received certifications as a holistic health coach from the Institute of Integrative Nutrition, holistic cancer coach from Breast Cancer Organization, and also Center for Advancement in Cancer Education, and certification in plant-based nutrition from Cornell University and the Colin Campbell Foundation. Due to this impact on Indian healthcare, Samara has been on multiple platforms, a regular TEDx speaker, and recognized in the medical fraternity as one of the first reputed companies to introduce integrative and holistic care into mainstream and cancer treatment. Welcome, Samara, to our board, and I would like you to begin your class, ma'am.
Thank you so much for having me here today. Thank you, Dr. Rashmi. I want to thank Dr. Nanda for even starting, a platform such as this. It's such an important endeavor. I am going to share a presentation, if that's okay, and give you a little snapshot of integrative care and how important it is to include integrative modalities of care into cancer treatment as well as post-treatment care. So if I can just be allowed to share my screen, just give me a second, please. And Dr. Rashmi, please let me know once you can see the screen.
Yes, ma'am. We can see. We can see. It's visible.
Great. So I'm going to jump right in where I would like to present to you Carer. It is India's first and only integrative oncology solution. We focus on 3 aspects of care, which is oncology, nutrition, physical therapy, and mental well-being. So just to understand what the Indian cancer landscape is today, we are seeing more and more rising cancer cases. We see a lot of breast cancer cases for female, and now for male, lip, oral cavity, and lung cancer cases. We are noticing that there are about 14 lakh new cancer cases being registered every year, with about 8.5 lakh cases which are relating to deaths due to cancer. Now, unfortunately, in India, approximately 70% of Indians incur out-of-pocket healthcare expenses. And when it comes to the doctors and the patients, we experience multiple challenges. If we were to really filter down what the challenges the doctors face, it is firstly that there is a huge discrepancy between the doctor-patient ratio, and that translates into an overburdened oncologist who has limited time. And what happens is that relates to a low adherence to treatment, and also because the doctor and the medical team is unable to follow up and do long-term follow-up, there's a lot of patient dropout. When it comes to patients, there are many challenges as well. Of course, there is an increased treatment cost. About 70% of cases in India being diagnosed at stage 4. And as you know, the healthcare space is quite skewed. There is more healthcare facilities and tertiary care centers for cancer treatment being offered in tier 1 and 2 cities. So people who are, in tier 3 cities or in remote areas, they have to travel the distance and spend more in travel and accommodation. There is a lack of support system, and of course, a decreased quality of life. So what are the 3 major problems that we face? There's a low propensity to pay, there's a low adherence to treatment, and there's a broken and disrupted patient journey. This is where I would like to introduce you to CARO. It is India's first evidence-based integrative oncology and lifestyle management program. While mainstream cancer treatment is extremely important to provide to every patient who's going through treatment, providing personalized nutritional care that manages the nutritional deficiencies of the patient because of the treatment or the cancer itself is extremely important. And this is what we do. We have clinical nutritionists who are trained in oncology and who support the patient throughout the treatment journey as well as post-treatment. Then we have physical therapy. That's predominantly yoga, meditation, and physiotherapy that manages the physical discomforts such as pain, lymphedema, fatigue, post-surgery rehab, neuropathy, balance and coordination, muscle atrophy. A lot of people post-treatment have to get back to the same physical status they were before. And so we help in a lot of rehabilitation for patients as well. And then, according to me, the most important, which is the mental well-being and mental health aspect of care. So we have clinical psychologists and psycho-oncologists who help in managing the emotional and mental distresses of a patient, whether that's just sleep disturbances, whether that's anxiety, whether that is depression, whether that's a fear of relapse, whether that's going back to your work environment, whether that's communication with your spouse. There are multiple different mental obstacles that occur for patients, for caregivers, for survivors, and that's what we look at managing for all of them along with the caregivers as well. So what is integrative oncology? And as Dr. Rashmi had pointed out, what is integrative therapies? It is a very well-established way of treating patients around the world. So if we look at any major healthcare institute or cancer hospital, whether that is a Memorial Sloan Kettering, whether that is an MD Anderson, a Mayo Clinic or Johns Hopkins, they all have integrative medicine and integrative oncology units. And essentially what it is nutritional support, physical therapy support, mind-body practices, psychology counseling, and pain management. And this is done from an evidence standpoint, and it complements mainstream cancer treatment. And this is offered as comprehensive holistic care for a patient to manage the treatment side effects, distress relief, and treatment results and adherence. We see that integrative oncology is being practiced around the world, and as I mentioned, it improves overall quality of life, clinical outcomes, and increases survival rates. But what we also find is that cancer patients and survivors opt for integrative therapies all over the world. 90% of breast cancer patients are opting for some integrative therapy. But unfortunately in India, because there is no evidence-based integrative oncology solution apart from Carer, a lot of patients opt for herbal, natural, alternative remedies that can be detrimental to their health, and they don't inform their medical oncologist. So they stop treatment and then they come back with a progressed disease. So that is the solution that we are trying to provide to all cancer patients and survivors around the country by providing a scientific-backed, evidence-based solution that works with the medical fraternity, with your oncologist, to provide comprehensive care all through treatment and post-treatment as well. There is a lot of evidence and studies that support integrative oncology on different types of cancers. In this study that was published in the Journal of Oncology Practice, it speaks about how important exercise is during cancer treatment, and that it addresses fatigue and improves physical functioning and cardiovascular fitness as well. There's evidence supporting integrative oncology for breast cancer patients. ASCO, which is the Bible of clinical guidelines when it comes to oncology, now endorses integrative therapy as a part of clinical practice guidelines. And in this particular study, it talks about how breast cancer patients have used these various forms of nutrition, physical support, mental health support to reduce anxiety, stress, mood disorders, chemo-induced nausea and vomiting, and improve overall quality of life. There's another study, very, very interesting, for lung cancer patients, a large group of patients we see in India, especially in the male population. This is a study about, again, released in ASCO, and a study about how using integrative approach for just 3 months actually improved the overall functioning and physical functioning of lung cancer patients, but also had an impact on the increased probability of survival of the patient as well. Again, on gynecological cancers, and which basically, to sum it up, says that integrative therapies reduce the adverse effects and the symptoms, side effects of chemo and radiation, improving quality of life and function. Integrative oncology is practiced very much in palliative care as well. And this study talks about how just including an integrative approach for patients, their quality of life scores of fatigue and depression improved, their cognitive functioning improved, their social functioning improved, and there were lower rates of hospitalizations and opioid use. Another study of integrative measures for palliative care basically says that effective comfort can be achieved with proper judicious combination of palliative care nursing and other oncological treatments, such as radiation, chemotherapy, and surgery. So what we are coming to a conclusion of is that using these non-clinical therapies, your nutritional support, your physical therapy support, your mental health support, along with your treatment and also post-treatment, has a huge impact on your overall survival and your overall quality of life, and can keep your relapse rates low. But what we've also seen a lot of evidence on is that integrative therapies have been able to improve adherence to treatment and duration of therapy. Unfortunately, in a country like India, we are unable to even stick to the treatment regimen. And many a times this is believed because of financial constraints. However, sometimes or most times it could be a financial reason. There are many other factors that actually affect adherence to treatment. Things like, lack of communication and miscommunication, where the patient doesn't have enough information at the time of diagnosis, and don't realize that how important it is for them to stick to the treatment regimen. There's a lack of support for the patient throughout the treatment journey, even post-treatment support. The negative connotations that patient has to allopathic medicines. We did a study and we realized that many patients, as I mentioned before, would start feeling better and opt for alternative therapies and stop their actual mainstream treatment. And that's when we realized that that's coming from misinformation and that support needs to be given there. We also, saw that a lot of patients who are on long-term care and long-term treatment, like breast cancer patients who are on hormonal treatment for many, many years or maybe for their lifetime, forget to take their medication, which is very common. They go back to a normal life. Like all of us, we go back to our work, we start living our normal life again. And, sometimes, just taking medication every day can become a chore. And what we did is we started reminding patients and survivors and individuals at least 3 times a week to take their medication, and that actually improved their adherence to the treatment and the therapy regimen as well. The impact of carer has been large and wide, and we have been able to work with multiple types of cancers and extend our therapies to tier 1, 2 and 3 cities. Everything that we do is based on globally validated assessments. So we do a medication adherence score, which is an assessment to see how probable the patient is to stick to treatment regimen, or do they have a high risk of dropping out of the treatment. We run a lot of quality of life assessments like the QLQC30s, the site specifics, the PGSGAs. We've added a lot of assessments to this, the distress thermometer to understand the psychological stress of the patient, and then a lot of internal assessments as well. And this gives us a very good understanding of what is the quality of life of the patient currently, and how can we improve that better. We also extend this to a lot of patients beyond treatment. When we finish the treatment regimen, we have to go back to rebuilding our immune system. And a lot of patients, unfortunately, feel that, they will finish treatment and go back to that previous lifestyle that they lived. And that's what we are not looking for. That's what we want to make sure, that you can't go back to that lifestyle and you have to make changes in that lifestyle. And that's where we assist a lot of patients. And we start looking at how do we prevent a relapse? How do we keep relapse rates low? And now that, it is said that 90 to 95% of all cancer cases is because of some lifestyle related factor, whether that is, the air pollution, whether it's toxins, chemicals, smoking, sedentary lifestyle, obesity, the nutrition that we're consuming, high stress levels, hormonal imbalances. This is all somewhat lifestyle related. So we have to know that keeping a relapse at bay or preventing cancer can very much be in our hands if we just manage lifestyle. And if we were to go through treatment, we have to use lifestyle measures like nutritional support, physical therapy support, and mental health support to even just get through the treatment as well. Some of the data of what we have done is that, as you can see here, working with patients, we've been able to improve their nutritional status of weakness, appetite, nausea, digestion, fatigue, and acidity by 77%. If you just look at impact on quality of life, this is on just about 200 patients. We improve their fatigue, digestive issues, appetite loss, cancer, anxiety, pain, and nausea, about 86% in just 12 weeks, in just 3 months. And this is how patients are actually, taking 2 integrative therapies and responding so well when it comes to providing the supportive care. We just released our first clinical trial done in India for integrative oncology in the Journal of Precision Oncology. We did a very small trial with Dr. Vishal Rao at KCG Hospital for head and neck cancer patients. And as you know, with head and neck cancer patients, there's a lot of nutritional deficiencies that they face. A lot of them are on a feeding tube, and so there's a lot of malnourishment, and they really require support nutritionally. We also, provided physical support. They need a lot of, rehab, whether it is the physical rehab for your facial region, speech and swallow, and just basic, rehab because of muscle atrophy that happens due to malnourishment, due to lack of movement, because most of these head and neck cancer patients are doing some surgery or the other for their facial region. And then the third is the psychological element. And this is something that is very important for head and neck cancer patients, because most of them have done some surgery. There could be a facial disfigurement, and it takes a lot to get through that psychologically for themselves and their family members. So this was a trial that was just released. We have another very interesting trial that is going to be executed and started in AIIMS, All India Institute of Medical Science, and that will really kind of set the benchmark of integrative care in India. Our focus is that can we make it a part of mainstream treatment? Can oncologists, write and prescribe a certain treatment and then also say that you require integrative care as a part of your treatment? And can an oncologist, when treatment is completed and when a patient is in remission, can an oncologist prescribe integrative care for a patient to bounce back to a healthier version than they ever were before? Just to kind of give you an idea, we are with the patient from the time of diagnosis all the way to follow up. So if you look at this journey, we provide awareness campaigns on the ground through patient navigators. We help patient get access to funds and access to treatment. We then, once the patient gets access and is diagnosed and gets access to treatment, we then provide our care of protocol, which is the nutritional, physical therapy, and the mental health that we provide. And this is done predominantly on a digital platform. A patient just requires a phone and an internet connection, and we can provide our therapies to them. We actually work with a lot of patients in tier 2 and tier 3 cities as well. And we manage their complete quality of life throughout their treatment. And then, of course, post-treatment, where we help the patient get back to a healthier version than they were before and rebuild their immune system from a nutritional point of view, physical and psychological point of view as well. And that brings me to the end of this presentation. If there are any questions, I'd be happy to answer that. But thank you so much for your patience.
Thank you, ma'am, for that very informative session. If any of y'all have any questions or queries, please feel free.
Yeah.
Any questions?
This is
Can you hear me?
Maitri, go ahead.
Dr. Maitri, can you hear me?
Yes, we can hear you.
Yeah, that was a great presentation, Samira. I recently got board certified in lifestyle medicine, and after 28 years of clinical practice in nuclear medicine, where we deal with about 300 cancer patients every month. My question to you was, at what time point do the patients get involved? I mean, how, each cancer is so different, and the stage and the treatment strategies, management can differ so widely. So what would be like a general guideline? How would they tap into this resource? If you could break it down at a grassroots level, how exactly, if I know somebody with cancer, or if there's a question, how would we plug into this resource?
Sure. So Dr. Maitri, how it actually works, and you're absolutely right. And it has taken us years to get here because there's so many different types of cancers, and even you can break it down further to each individual is different. So even if you have a patient of the same diagnosis, prognosis, on the same treatment protocol, the approach that we would give is still probably would be very different. So what we have done is we've built a protocol that has some level of standardization, right? So we get some idea that the patient definitely requires nutritional, physical, and psychological intervention, because we always work with all three. But the extent of which therapy is given depends on the patient's parameters. So we do a thorough analysis of the patient when they come to us. So there are certain set parameters that we look at. So of course, there is all the clinical parameters that the team assesses, but then there are multiple non-clinical parameters. So we have a patient debrief form. We have a quality of life measure. It's a very extensive form, an assessment to give us a very good indication of what the status of the patient is from a quality of life. So what is the nutritional deficiencies of the patient? Is there any physical discomforts of the patient? Is there fatigue, lymphedema, pain, whatever the physical issues might be? And what is the psychological status of the patient as well? With that, we run another assessment, which is basically an adherence score. So it gives us an idea of this patient in terms of how likely are they able to stick to the treatment regimen. So we get a very good analysis of the patient before we even go in to provide therapy. Once we get the analysis, because we have been doing this for many years and we have worked with thousands and thousands of patients and built multiple data points, there is to some degree that we have built, inbuilt data sets and patient profiles, especially for things like nutrition recommendations. So we have some level of understanding that a patient, maybe a breast cancer patient, stage 2, has done, a double mastectomy or whatever that might be on a certain treatment or whatever it is. And these are the quality of life parameters of this patient. This is somewhat of the intervention we should give. And that is all built, inbuilt data sets that we have done through technology over a long period of time. Having said that, while we are completely tech enabled, we are completely providing a human intervention in the front end. So the patient never talks to any bot or AI or anything like that. The patient is always communicating with a patient care coordinator, a patient navigator, a clinical nutritionist, a yoga therapist, or a counselor. And that is one-on-one. So while the information is given to the therapist on the background of the patient as much as the technology can give, and it's also linked to a lot of external global studies, obviously nutritional guidelines, global guidelines that we follow. The nutritionist will always use his or her professional knowledge to tweak the intervention based on when they have that interaction with the patient to make it as personalized as possible. So that's how we can really personalize our approach with every type of cancer and type of person, if I can say. In terms of how do we connect to a patient, so we work on multiple. So we ideally, provide therapy as soon as a patient is diagnosed. So we have patient navigators. We work with a lot of companies that allow us to have patient navigators in various hospitals, in various institutes on ground, where the hospital is very much aware that there is a patient navigator, and as soon as a patient is diagnosed, they send them to us. Or doctors are aware of our therapies, so they refer the patients directly to us. We work with a lot of pharmaceutical companies because as patient support programs, so there we get a lot of access to patients. We tie up with multiple hospitals, so that's another way we get access to patients. Or we have our website, a toll-free number. Patients call us up directly. And because now we work with so many patients, word of mouth is extremely powerful, where a lot of patients come to us because they have, someone in their cancer support group or a friend or a family member has gone through it. But we always recommend providing our intervention as soon as a patient is diagnosed, throughout the treatment journey, and very much, post-treatment as well. I hope that answers your question, Dr.
Yeah, sure. Yeah, that was very informative. Thank you. Cost-wise, what are we looking at? A stage 2 breast cancer versus a stage 4 colon cancer could be quite different. So is it like a time-bound, or is it like a package, or?
Yes. So it really depends. So it is time bound because we have 3 month, 6 month, 9 month programs. It is also very much in line with what the intervention requires. So we have a standardization of that you need so many interventions minimal per month. And if a patient we feel that requires more physical therapy support, we would always add more sessions of physical therapy and say this is your price point. So we keep it extremely economical, but it's very personalized to what the patient requires. We don't really have set packages per se. It's really kind of personalized to the patient. Then if you're working with say the pharma organizations, then you're working on a very different price point because they are sending you, 500 patients, 1,000 patients. So that quantum of patients, then the price point can go very low. There are some patients who want all therapies in their home, or they want more home care therapies for, say, just physical therapy, then that comes at a different price point. So we've kept it quite, it's still always affordable, but very personalized to what the patient requires.
So if it's on site, you have a network of people who can go to the patient's house. Is that what you're saying? Or is it all online?
No, everything is online. There are maybe 2% of all our entire patient cohort is probably doing, and also that is mainly physiotherapy in tier 1 cities, but majority is a digital interface.
Okay, and are there recorded sessions, or is this live, or what is the percentage of?
Live, completely live, one-on-one sessions. We are starting group sessions for a larger group of patients, but all of them are one-on-one live sessions.
Okay, great. Thank you.
Thank you.
Yeah.
Thank you, Dr. Maitri, for that doubt, and thank you, ma'am, for clearing it. Any more questions or queries?
Yes. This is Dr. Sandhya. I'm from Prameya Health. Thank you, Samara. That was a very nice, description of the work that you do, and it's really amazing the kind of integrative oncological practices that you've managed to give to the patients. So I run a preventive and supportive care organization, and we have been working in the area of cancer support. So we have support groups. We've been doing this since 2016. Like you said, the important areas that we've recognized are the physical, the nutritional, and the emotional spaces. So we called our program the Sahai program, and it's the PENS model, PNS. So
okay.
Also added a spiritual element into it, because the long time it really helps the patient go through the whole process, and also it, the post-traumatic growth, really, we can see that happening in most of them. So we've also published a few papers. We presented our work in ESMO, and it's more from a support group perspective. So we have patients come to us, and they enjoy being part of this group. And long after the treatment is completed, they wish to continue and try and motivate other people who have just been diagnosed and things like that.
Okay.
One question that I have for you is when you work in the hospitals, there's when patients are undergoing treatment, you help with the nutrition, you help with physical activity, rehab, etc. So is there a lot of connect with the treating doctors then?
Absolutely. So in fact, when we work with hospitals, we never replace what's happening in the hospital, because we're very well aware of the fact that a lot of the private institutes have nutritional support, they have their physical, they have their mental health department, but we have recognized that the problem actually lies in implementation. So we always tell our doctors that the patient and the caregiver will say yes to whatever you're saying when they're sitting in the doctor's chamber. But when they go back home, who is monitoring, who is implementing, who is evaluating whether there is an improvement in outcomes? And that's why the patient comes back neutropenic. That's why the patient comes back malnourished. That's why they get off treatment for a while. They can't stick to the treatment regimen. They're not able to cope with the side effects, because the hospital setting is able to manage all the patients in the hospital. When we tie up with hospitals, we become an extension of care, where we then provide all of this support back into the patient's home from a digital standpoint. So we don't really do home care anymore as we used to before. But to answer your question, the oncologists are very much a part of what we do. So even if a patient reaches out to us directly, the first question we will ask is, who is your referring doctor, or who's your practicing doctor right now? Who is your consultant? And then we reach out to that doctor saying, this patient came to us, and this is the program that we're going to be offering your patient. And not only do we do that, we provide, so as these assessments that I presented to you earlier, all the data points of that assessments become consolidated patient progress reports every month that we send back to the patient, their family, and the medical doctor. So it really motivates the patient because they can see, okay, I'm improving so much over here, I've improved so much in physical, there's so much more to go. But for the doctor, it gives him or her a very good understanding of how his or her patient is doing. We've also created a live doctor dashboard where the doctor or his, say executive assistants or associate doctor can log in at any point in time and see, how many patients have come onto our program, how many of his patients, of course, have come onto our program, how they're doing, what diet plans were given, how are they improving, detailed case studies, and that is at any point in time. But we are constantly in touch with the doctors. Even if they don't really want to hear from us, we are constantly giving them updates on how their patients are doing.
Okay, yeah, thank you. Because in an inpatient setting, I would think sometimes there could be a conflict within the.
Exactly. Yeah. So we don't come in and replace that at all.
Okay. Thank you. Thank you.
Any more doubts? Thank you all for your patient hearing. A recorded version of the same talk will be available. Thank you, ma'am, for such an informative session. Have a
Thank
good
you.
day.
Thank you. Thank you so much, Dr. Rashmi. Thank you, everyone.
Thank you. Bye-bye.